My name is Jennifer Horney. I'm the founding head of the new program in epidemiology in the College of Health Sciences at UD. And initially, when Aaron had asked me to come talk, I thought I would talk a little bit more generally about the epidemiology of COVID. And then thinking about the audience, I thought I would talk about a little quick research project that we just did. This just got accepted for publication last night, actually. So this might sort of give a little bit of perspective on the public health response. That might be new information to you guys depending on your background. So our question that we wanted to look at was whether timeliness and extent of COVID-19 social distancing was associated with public health department structure. And so let me just spend 2 seconds talking about public health control measures. So typical control measures from public health for a respiratory transmission disease would be things like post-exposure prophylaxis, isolation of infected patients, quarantine of exposed individuals, and then other types of infection control. So the big issue here is that we don't have that first bullet point of post-exposure prophylaxis. We don't have a vaccine, we don't have any drug treatments. So we're really relying on isolation, quarantine, and infection control. And so from that extent, what we're really doing are these social distancing control measures. So we've closed schools and universities. The governors have, for the most part, issued stay-at-home orders. We've closed non-essential businesses. In some cases, there are travel restrictions. Certainly, all of those are in place now in Delaware. So I just wanted to show you guys, and you can see this. She updates this on Twitter pretty regularly. This kind of way that disaster epidemiologists like myself think about research. So instead of thinking, gosh, I had a research project that was interrupted by COVID and now it's ruined, we kind of think about ways of looking at ongoing research as a natural experiment, or maybe comparing, I had people in my trial and now they've missed their final visit, so how am I to know what would have happened? Maybe think about other reasons why trials might be interrupted, natural disasters, other types of health impacts that may affect those that are enrolled that might interrupt treatment. So thinking about how we can use what we're stuck with to learn something. I think this is a really interesting example of that and of the importance of these social distancing measures. So this family physician has put together basically a guide showing the differences between when Kentucky and Tennessee, which are fairly demographically similar and right next door to one another, implemented their various social distancing measures and how many cases of COVID they have. So this is per number of cases. And you can see that Kentucky is the blue boxes, and they declared it a state of emergency about a week before Tennessee. They closed schools about a week before. And so the number of positive cases that are reported in Tennessee, which was lagging behind, are significantly higher than the number in Kentucky. So this is just like one little example of trying to show how this works. So what we were interested in is understanding if the governance structure for state public health had anything to do with the implementation of these social distancing guidelines. And there's actually a pretty robust literature looking at public health emergency preparedness and public health agency structure. Some previous studies that I've worked on have shown that centralized health departments, like we have here in Delaware, which means that the health department employees are state government employees, and the decision-making is made at the state level, are less effective at expedited hiring and purchasing required during an emergency. They have lower pandemic plan comprehensiveness, so their pandemic flu plans are not as good, and they have less ability to deploy resource sources during an emergency. And I think this is one of those questions that's really interesting because at first glance, it would seem like a centralized governance structure for public health would be better at doing all of those things, that you would just have one decision maker and they would be able to quickly decide, hey, we need to hire people, we need to purchase things. But it seems like it's too much decision-making concentrated in a single point, and that state health departments have to manage both vertically, up and down from local to federal, and they also have to manage horizontally across all the other state agencies like emergency management or the Department of Education, who might be involved in these decisions. So there's a lot more data in the paper, but I just want to show one issue here. So basically, a regression model looking at department structure adjusted for the number of social distancing actions, the per capita expenditure on public health, and the population count showed that centralized health departments had a 73% reduced likelihood of enacting a social distancing policy. And so decentralized health departments were more likely to introduce those policies and to introduce them more quickly. And so I think this has some important implications for policy and practice. So if we think about other areas that may be relevant to you guys, like trauma care, there's a lot of research showing that a more collaborative organizational culture with more delegation of decision-making improves teams' ability to perform during an emergency. So it's not that public health is unique in this way. We've seen this across a number of different fields. So our recommendations are to think about the potential weaknesses of a centralized public health structure for emergency preparedness and response, and potentially have additional studies about the potential benefits of decentralization. So as we know, from a national basis, public health is decentralized. We have CDC. We have nearly 3,000 local health departments in the United States. So where we get this big difference is at the state level in terms of the centralized states like Delaware and the more decentralized states with local health department decision making. So that's just I don't know if that was 5 to 8 minutes, but this is my contact information. We're working on a number of other projects related to COVID, but I just thought this is something sort of hot off the press that maybe new to you guys to think about and a little more interesting than kind of an overview of the epi of COVID-19 right now. So thanks very much.